Hello, I'm Dr. Bill Waggoner. Welcome to today's Tuesday Tip. I recently told you about an article that had been published this year in the Journal of Pediatric Dentistry that looked at the predictability of the need for a second general anesthesia appointment for children based on whether or how their second primary molars were restored at the first GA appointment. Well, interestingly, this past week I was looking through some old articles and I found another publication from 2003 that also looked at the reasons for repeat dental treatment under general anesthesia for healthy children. It was authored by Scheller and others and was in Pediatric Dentistry, Volume 6, 2003. In this article, the authors focused on several factors that lead to repeat general anesthesia appointments for healthy children. Here are some of the common characteristics of children that required repeat care under general anesthesia. Number one, they had 100% involvement of all the maxillary incisors at the time of the first GA. Number two, the majority of their maxillary incisors were non-restorable at the time of the first GA. Number three, they were still using a bottle at the time of the first GA. Number four, the child was responsible for brushing their own teeth. Number five, the child exhibited poor cooperation in the dental and the medical setting. Number six, the child had a, quote, difficult personality as described by the parent. Number seven, there was some dysfunctional social situation involved. And number eight, there was a lack of follow-up care. Wow, and that seems to describe so many of the children that I end up taking to the OR. But you know, two additional notes. Number one, they found that stainless steel crowns were the most successful restorations placed. And that's not surprising because it's been confirmed in numerous studies. And number two, although the authors of this paper did not specifically look at the treatment of primary second molars as a factor for repeat anesthesia, it should be noted that if second primary molars were either not treated or were not erupted at the first GA visit, 83% of them required restoration at the second GA visit. These were the most susceptible teeth by far to require restoration at the second GA visit if they had not been treated initially. Now, all of these findings are kind of depressing because they seem to describe so many of the children that I end up seeing in the OR. The authors of this 2003 article recommend the best outcomes to avoid a second GA may result from 1. Aggressive treatment planning of caries, 2. An active and aggressive follow-up protocol, and 3. The continued education of parents. Now, as I recommended in my previous Tuesday tip, when we do treatment plan aggressively on these high-risk children, it requires very good pre-op communication and education with the parents. And it also requires very good documentation in your op notes of all of the existing caries risk factors present, which may be leading you to more aggressive treatment. Well, thanks for listening. I'll see you next time.